So I'm looking at a news report, a news release from Allergan, and a lot of phone calls have been coming in regarding the recent Allergan statement about their warnings against detextured silicone implants. And we don't want to alarm anyone or scare anyone, but we do want to mention some general statements. Number one, for my patients particularly, and probably Dr. Leong's as well, in the smooth, round silicone implants, there has been no evidence of any linkage of the ALCL. The ALCL is primarily linked with textured implants.
Mm-hmm. Yeah. So I mean, everyone who's calling in, they have two main questions. Number one, what type of implant do I have? And number two, do I need to take them out? So as Dr. Park said, in this office, for cosmetic breast augmentation or breast lifts, anything with implants, we have never used textured implants. So only smooth round, and there have been 0 cases of these reported with this ALCL. The rare subset of patients that do have the textured implants in this office are breast reconstruction patients, and the recommendation for those patients is that we should leave those implants in unless you have specific symptoms, and those can usually include increasing size of one side, like there's fluid, pain, asymmetry, if you feel a mass, anything that causes you concern with that breast anyways, just have it checked out. But the recommendation right now is not to remove those implants.
Correct. And it's also important to note that the link of the cancer ALCL is not specifically a breast cancer. Would you say that's true?
Right. It's not a breast cancer, and it's not a lymphoma, even though that word gets tossed around a lot. Mm-hmm. There's a cure for this if it's found, and it's a local, so that means that it's contained within that area. It doesn't tend to spread. Mm-hmm. So I think a lot of people get very worried when they hear lymphoma, especially if you've already gone through breast cancer, and all of a sudden you're like, what, lymphoma?
Right.
But this disease process can be treated. It can be cured by removing the tissue and removing the implant. So I think right now it's just about awareness. So absolutely go call and ask what kind of implant you have. Keep that information. It's good to have anyways. But know that with the smooth round, it's not an issue. And then with the textured, only if there are concerns.
Correct. And I think the biggest sign would be, as you mentioned, swelling. And the detection is in the fluid around the implant.
Mm-hmm.
Correct?
And that scar tissue around the implant.
Right.
So they test for a very special marker that tells you whether or not that tissue has those cells that are abnormal. But again, it's symptom driven, and usually even with the textured implants, you don't see this happen until 8 to 10 years after you've had the implants. So for any of you who want to read more about the nitty gritty and the details and the numbers, Dr. Park is currently downloading the link, and it's going to be accessible right here. So click on that and you should be able to get all the up-to-date information that we have.